Hello all, I am Dr. Vibhash Vaidya and today in this video we are going to discuss about the mediastinum. So what is mediastinum? The mediastinum is a space in the thoracic cavity which present in between two lungs. Now the boundaries of the mediastinum. First, the anterior boundary of the mediastinum is formed by the sternum. Here we can see this is the sternum. And this picture, which is a schematic picture of the thoracic case, and most anteriorly we can see this is the sternum bone which form the anterior boundary of the mediastinum. In the same manner, the posterior boundary which formed by the thoracic vertebral column. Here we can see this is the thoracic vertebra and it formed from the T1 to T12 thoracic vertebrae. Then the superior boundary of the mediastinum is formed by this superior thoracic inlet or superior thoracic aperture. Then the inferior boundary is formed by the diaphragm muscle, and this diaphragm muscle which attach over this inferior thoracic aperture or thoracic outlet. Here we can see this is the inferior thoracic aperture. And on each side the mediastinum is bounded by the mediastinal pleura. Now we'll discuss about the divisions of the mediastinum. So the mediastinum is broadly divided into superior and the inferior part. Further, this inferior part is divided into anterior, middle and the posterior part. Here in this slide we can see this is the schematic diagram of the sagittal section of the thoracic cavity. Here we can also observe an imaginary line which passing through the sternal angle anteriorly to the junction between the T4 and the T5 thoracic vertebra posteriorly. And this imaginary line which divide this mediastinum into two parts, superior small part and the inferior large part. Here this superior small part is called the superior mediastinum and this inferior large part which is called the inferior mediastinum. And this inferior mediastinum which also divided into three different subdivisions. First we can observe here this is the anterior mediastinum, then this is the middle mediastinum, and most posteriorly this is the posterior mediastinum. Then in this slide this is another picture. Then in this slide this is another schematic diagram of the thoracic cavity, sagittal section of the thoracic cavity, which shows an imaginary line which passes through the sternal angle to the junction between the T4, T5 thoracic vertebra, and this imaginary line which divide this superior small part which is called the superior mediastinum and this inferior large part which is called the inferior mediastinum. And further this inferior mediastinum is divided into this anterior mediastinum. Here we can see a small anterior mediastinum, then this large middle mediastinum which contains the heart, and behind here we can see this is the posterior mediastinum. So these are the subdivisions of the inferior mediastinum. Now first we'll discuss about the superior mediastinum. So as we know, the superior mediastinum which present above to this imaginary line, and this superior mediastinum anteriorly bounded by the manubrium sterni. This is the manubrium sterni. In the same manner, the superior mediastinum is posteriorly bounded by the body of the T1, T2, T3 and the T4 thoracic vertebra here. Then it superiorly bounded by the superior thoracic aperture or the thoracic inlet. The same inferiorly, this superior mediastinum is bounded by the imaginary line and this inferior mediastinum. And on the each side, the superior mediastinum is bounded by this mediastinal pleura. Here we can observe this is the mediastinal pleura which enclose to this lung. Then the contents of the superior mediastinum. So this superior mediastinum which contains some arteries and veins. So first we look about the arteries which present on the superior. So first we'll see the arteries which present in the superior mediastinum. So first here we can observe it contains the arch of aorta and its branches. On the right side it contains the brachiocephalic artery and on the left side it contains the left common carotid artery and the left subclavian artery. If we look about the veins, so it contains the superior vena cava, then the left brachiocephalic vein and the right brachiocephalic vein and the left superior intercostal vein. Along with this arteries and the veins, the superior mediastinum also contains some other structure like pharynx and the vagus nerve, then the left recurrent laryngeal nerve. Here we can see this is the left recurrent laryngeal nerve and the vagus nerve, and the trachea over here, this is the trachea, then the esophagus, here we can observe this is the esophagus, and the thymus gland, here this is the thymus gland. So these are the contents which lies in the superior mediastinum. Thymus and the thoracic duct. Here we can see this is the stem of the thoracic duct. So these are the contents which lies in the superior mediastinum. Now we'll discuss about the arrangements of the structures. So from the anterior to posterior, the structure arranged as a most anteriorly, we can see the thymus gland is present. Then just behind to the thymus gland, here we can observe the large vein is present. Then the large artery, this is called the arch of aorta and its branches. After the large artery, here we can find the trachea. Then the most posteriorly we can find the esophagus. So anterior to posterior we can find the structure like thymus, then large vein, then the large artery, then trachea and the esophagus. So these are the structure which arrange in the superior mediastinum. Then the clinical anatomy. So potential dead space in the superior mediastinum. The all large vein are on the right side and the artery on left side. During the increased blood flow, the large vein expand aneurysmally. During increased blood flow, the large vein expand aneurysmally. During increased blood flow, the large vein expand aneurysmally due to sufficient dead space on the right side. While large artery do not expand at all, the tumors of the mediastinum tends to project. Now we'll discuss about the anterior mediastinum. So as we discussed in earlier slide, the anterior mediastinum is a subdivision of the inferior mediastinum, and anterior mediastinum which anteriorly bounded by this body of the sternum. Here we can see this is the body of the sternum, and this anterior mediastinum which posteriorly bounded by the pericardium of the heart. This is the pericardium of the this is the pericardium of the heart. Then superiorly this anterior mediastinum is bounded by this imaginary line and the superior mediastinum, and the inferiorly this anterior mediastinum which bounded by this diaphragm, and on the each side the anterior mediastinum is bounded by the mediastinal pleura. Now the contents of the anterior mediastinum. So it contains the loose alveolar tissue, the superior and inferior sternopericardial ligaments, the lymph nodes and branch of the internal thoracic artery, and the lower portion of the thymus in case of the children. So these are the contents which present in the anterior mediastinum. Now we'll discuss about the clinical anatomy. The anterior mediastinum is a very narrow space. It continues with the superior mediastinum by the pretracheal space of the neck. So the neck infection of the pretracheal space may spread to the anterior mediastinum. Then we'll discuss about the middle mediastinum. Here we can see this is the middle mediastinum, and the middle mediastinum is a subdivision of the inferior mediastinum. So anteriorly this middle mediastinum is bounded by the anterior mediastinum, then the posteriorly it bounded by this posterior mediastinum, and the superiorly this middle mediastinum which bounded by this imaginary line and the superior mediastinum, and the same manner inferiorly this middle mediastinum which bounded by this diaphragm muscle. So these are the boundaries of the middle mediastinum. Now we'll discuss about the contents which present in the middle mediastinum. So it contained the heart with the pericardium. Here we can see this is the heart and the pericardium. Then it also contains some arteries like ascending aorta. Here this is the ascending aorta, pulmonary trunk which present just behind to this thymus gland, and it also contains some veins like the superior vena cava, then the azygous vein. Here this is the azygous vein, stem of the azygous vein, and the tributaries of the superior vena cava, and the pulmonary veins. Then it also contains some nerves. Then it contains some nerves like the pharyngeal nerve. Here this is the pharyngeal nerve. Apart from these contents, it also contains some other structure like lymph node, the tracheobronchial lymph nodes, then tubes, and these tubes are the bifurcation of the trachea and the right and the left principal bronchi. Now we'll discuss about the posterior mediastinum. So here we can observe this is the posterior mediastinum, and as we know the posterior mediastinum is a subdivision of this inferior mediastinum. So it anteriorly bounded by this middle mediastinum. Here we can see this is the middle mediastinum which form the anterior boundary. The same manner the posterior mediastinum is posteriorly bounded by this body of the lower 8 thoracic vertebrae, and superiorly this posterior mediastinum is bounded by this transverse imaginary line and this superior mediastinum, and the inferiorly this posterior mediastinum is bounded by this diaphragm muscle, and on the each side this posterior mediastinum which bounded by the mediastinal pleura. Then the contents of the posterior mediastinum. So it contains the descending thoracic aorta. Here we can see this is the descending thoracic aorta. It also contains the azygous and hemiazygous veins. Then it contains the esophagus. Here we can see this is the esophagus, the thoracic duct. Here we can observe the thoracic duct, then the vagus nerve, then the sympathetic trunks. So these are the contents which present in the posterior mediastinum. Then the applied anatomy. So first clinical condition is mediastinitis. So the mediastinitis is an inflammatory condition of the mediastinum. Then the mediastinal syndrome. The mediastinal syndrome is a group of the symptoms which occurs due to the compression of the mediastinal structure due to any growth of tumors and the cyst. Then the widening of the mediastinum. The widening of the mediastinum seen in the chest radiograph due to the hemopericardium, tumors, enlarged lymph node and the cardiomegaly. Then the mediastinal shift. The mediastinal shift seen in the lung due to the hemothorax, pneumothorax and the pleural effusion. Then the extension of the pulse into the posterior mediastinum from the superior mediastinum by space between the pretracheal and the prevertebral layer of the deep cervical fascia. Then the extension of the pulse into the thigh from posterior mediastinum by a sauce sheath thickening down to the femoral triangle. So this is all about today's lecture. I hope all of you understood the lecture. Thank you for watching. Vertebrae.